Hey, hello and welcome everybody to this week's training. We are going to go over shaken baby syndrome, what it is, some of the ways that we can avoid it, and just some helpful tips and tricks on the best way we can make sure that we're taking care of these babies that we work with. So jumping in, shaken baby syndrome, it's a term used to describe the constellation of signs and symptoms resulting from violent shaking or shaking and impacting of the head of an infant or small child. So the key word here is the violent shaking. I know a lot of people in play do shake little infants. As long as it's not violent, they're okay. Results of shaken baby syndrome. So what happens when you shake a baby violently is you are shaking their brain around in their head. When they're little, they don't have, their brain doesn't have the ability to stay in place like it does when it's more developed and when you are older. And so the shaking of their head causes the brain to smack across the bone, the rest of your skull. And the things that can cause is partial or total blindness, developmental delays or learning problems or behavior issues, intellectual disabilities, again, going along with the learning problems, different things like that. It can also cause seizure disorders and cerebral palsy. There's other things that it can cause that makes it so that they have to have medical needs for the rest of their life met. So again, going back to why it happens, babies have weak neck muscles, so they can't control their head. So when you shake them, that's what's causing their head to fall back and forth. And that's what causes their brain to move around, and it will cause damage to the brain. This damage normally is caused or it occurs when a parent or caregiver severely shakes a baby or toddler. So again, it's that severe, it's the violent, and it's normally done out of frustration or anger. We're taking care of a kid, they're just constantly, continuously crying, and we get frustrated and we just really want them to stop. And so we just shake them, trying to get them just like, please stop crying. And that really does more damage than it does any good. Before I continue on, are there any questions about what causes the actual condition of shaken baby syndrome? Perfect. So the following are not causes of shaken baby syndrome. So if you do these things, it's not going to cause their brain to move so dramatically that it will cause that damage. So again, I mentioned the gently tossing a baby during play. This, you do need to know that you can cause neck problems if you toss them too early. If they still have very limited control of their neck, you can hurt them in that way, but you won't be causing shaken baby syndrome. So typically the general rule of thumb is to not toss a baby into the air until they are at least 6 months old. At that point in time, they've had a lot of practice holding their head up. They also at that point normally are able to sit up. So they've got a lot of that control over their head and balancing. Bouncing a baby on your knee or in your arms also will not cause shaken baby syndrome, again, unless it's super violent or aggressive. If they fall off the couch, that will not cause shaken baby syndrome. They might hit their head though, and that can cause damage as well, but it's not going to be the shaken baby. And then jogging or bicycling with an infant or toddler is also not going to shake their head severely enough to cause shaken baby syndrome. Any questions about these things before I move to the next slide? Okay. So risk factors, sorry, things that make you more at risk for causing shaken baby syndrome to a child. These things are things that we can avoid if we follow some of the procedures that I will talk about later. So just know that risk factors, it simply means that you're at a higher likelihood of shaking a baby, but it does not mean that you are guaranteed to. So if you have unrealistic expectation of babies, such as going back to my very first example, they're crying and you're trying to get them to stop. So you've met all of their needs, you've fed them, you've changed them, you've been holding them, and they just are still crying and crying and crying. Expecting them to stop crying just because you've met their needs is very unrealistic. Sometimes babies have something wrong that we aren't aware of. They might be feeling sick, they might have colic, just different things like that that cause them discomfort that we can't ever really do anything to help fix. Other unrealistic expectations are expecting a little infant or toddler to be able to know things that an adult should know. Like we don't hit other kids. That's very unrealistic. We haven't taught them that yet. They don't know that. So that can be something that can cause us to get frustrated with them. Other things that can cause frustration or stress is being a young or single parent. Unfortunately, when you are with a child all day, every day by yourself, it gets very frustrating and very tedious. There's a lot of things that come up. They depend on you for everything in their life. And it can get very tiresome at times to constantly be taking care of another human being. So that can be a risk factor. Too much stress. If you've got a really high stress job and then you come home and you're immediately taking care of a baby as well. Or if there's a lot going around at a daycare, there's a lot going on, there's a lot of noise. That can cause stress, which can cause, again, that frustration. Domestic violence, alcohol or substance abuse, and unstable family situations are all kind of very similar. They're bad home lives that either you're experiencing or you know a close friend or family member that is experiencing. That can cause stress and anxiety, which again can just raise your levels of frustration, which makes it a lot easier to get frustrated at the baby. And then depression can also be a risk factor because again, you're just not in a mental place to be able to handle all of the stresses that come with taking care of a baby. And then a history of mistreatment as a child. So if you were abused as a child in any way, shape, or form, that can cause your stress levels to be elevated faster and quicker. It doesn't mean that you are mistreating your child just because you were mistreated as a child, but it does oftentimes mean that your stress levels are heightened quicker. Any questions with these risk factors or any that you know of that you wanted to bring up as well? Okay. So some symptoms or signs that a child has been shaken to the point that it will have caused shaken baby syndrome. If they all of a sudden become extremely fussy or irritable, this is outside of their normal. They were totally fine. It's very sudden onset. They get very extremely just fussy, won't calm down. They have difficulty staying awake, which typically isn't just like they seem extremely tired, it's more they seem extremely lethargic. So their eyes often will glaze over even after they've just woken up. They seem to just constantly be tired. If they have difficulty breathing or they aren't eating as well as they normally typically do, that can be a sign of shaken baby syndrome. Vomiting, seizures, and paralysis are all three pretty extreme ones that can be a pretty big sign. And then the pale or bluish skin can also be the sign that their brain has been damaged. And then if they're all of a sudden going into a coma, that's probably the most extreme thing that will happen from the shaken baby syndrome as a symptom or sign of it. If you think that a child has been violently shaken, if you're seeing a lot of those signs or symptoms, you need to seek immediate help, which means calling 911, getting immediate medical attention for that child. Doing so could most likely save that child's life and prevent serious health problems. Unfortunately, with shaken baby syndrome, no matter how soon you catch it, there will always be some lingering side effects from that. But if you get them that immediate, very quick medical care, you are more likely to save that child's life, and you can prevent, again, those very serious health problems that would affect them for the rest of their life. Any questions before I move on to some of the ways that we can help prevent shaken baby syndrome? Okay, so let's move on to probably the biggest reason that people get frustrated with little infants, crying. Crying is very often loud and annoying when it drags on for a long time. It's not a fun sound to be right next to, especially when you're holding them. So there are different things that we can do if a baby is crying a lot. First and foremost, make sure that their physical needs are met. That means that you've checked their diaper. If they're wet or poopy, you've changed them. You've adjusted their clothing. If they're in clothing that seems sweaty or wet, you've changed them out of it. You've fed them. You've tried comforting them. And then you've also checked for anything else that could be causing discomfort, such as a tag in their clothing, if they've got a hair somewhere, just anything that could be causing them discomfort or annoying them and causing that crying. Once you have checked and made sure that you have met all of their physical needs, if they are still crying and it becomes too much, there's 3 different things that I recommend doing. The very first one is, if there is a child or if there is another adult in the room with you, hand that child off to them. They haven't been holding them, so even though they've been hearing it, they're more likely on a lower stress level or anxiety level than you are. So hand the child to the other adult if they are available. If they're not available, if there's not another adult in the room, if there's not another adult that can come to the room, place the child in a safe place and walk away for a few minutes. They are going to be okay if they are crying by themselves, so that you can take a breath and breathe and come back and be in the better headspace to continue to help them and comfort them. That is the number one I always recommend. Don't ever be afraid to place a baby down. They will be okay. They will be safe. And oftentimes, if they're unconsolable, they're not going to get more upset. They're going to just continue to cry on the same level that they have been. And sometimes placing them down is actually what they want. Sometimes they just need a little bit of space themselves. So again, don't ever be afraid to place a baby down. Make sure it's in a safe place so they're not around other kids that will try to shush them or could walk over them while they're crying as well. And then if you have the chance, always talk to the parents and see if they have any advice on how to handle their child if they're crying continuously, or see why it might be happening. I just went and had our 2-month appointment for my son, and he got shots and was in a lot of pain. So he cried a lot more than he normally does. But knowing that, we were able to kind of know that he had these shots, so the area where he got the shots is going to be sensitive. And there's things that you can do to try to aid in their pain level as well. You can massage the area, you can get a warm cloth or something and kind of get that water on their legs as well. So there might be something that the parents can tell you as well when you talk to them. Anything else from this slide or the last few slides before I move on to the last one? Okay. So always remember, again, it is better to put a child down and walk away. They won't die. They will be okay. They might get a little bit more upset, but they will be okay if you leave them to cry on their own for a second so that you can make sure that you are in a safe headspace to continue to care for that child. Remember too that just because a child is crying with you does not mean that you are a bad caregiver, does not mean that the child doesn't like you. Most of the time when a child is crying, it has nothing to do with you. So again, just remember that you're not a bad caregiver just because a child is crying with you. And then remember too that crying is an irritating sound and everyone gets frustrated with it. It's supposed to be irritating. It's supposed to be something that draws attention to it, because this is how babies get your attention. They can't do anything for themselves. And so their crying is a way to let you know that, hey, something is wrong and I need help. And then make sure that you have the coping skills to handle the situation. Know beforehand what you're going to do. If you're more comfortable with trying to get another caregiver in there instead of trying to just place the child down, ask the director before you even go into the classroom if that's something that you would be able to do. So again, just make sure you've got the coping skills, and then always remember that it is better to put the child down, especially when you can feel yourself getting to that point of frustration. Any questions or any comments, anything that you think I missed, or just ways that you've found that have been helpful as well?